Hello and welcome to TheCosmicNp. Today we're exposing a critical issue facing nurse practitioners in critical care across India. The government introduced this program to upskill nurses for ICU roles, but there are no government jobs available for these graduates. Many nurse practitioners in critical care face curriculum gaps and lack proper training, leaving them unprepared for real-world ICU demands. The degree does not meet international standards. If India doesn't recognize nurse practitioners in critical care, foreign countries won't either, leaving graduates struggling and disappointed. Many final-year nursing students in India are confused about the role of a nurse practitioner in critical care. Despite the program's promise, most students lack clear understanding and practical exposure. Outdated classrooms and limited hands-on training mean students are not being properly trained as per the curriculum. This leaves many unprepared for real-world critical care settings. Awareness about the nurse practitioner in critical care program remains low, partly because students rarely see real-life examples or role models in their training. Internationally, job postings for nurse practitioners in critical care often list Indian graduates as not eligible, highlighting the lack of global recognition for the program. A study involving graduates of the nurse practitioner in critical care program revealed a troubling reality. Despite advanced training, many are still assigned to regular staff nurse roles. They lack practical skills, legal recognition, and the authority to prescribe, because their role isn't officially recognized. Even after completing the nurse practitioner in critical care program, graduates face legal barriers. Their qualifications are not recognized by current laws, leaving them without autonomy or prescribing rights. To make matters worse, their degree is not accepted abroad due to gaps in education and training. International hospitals often reject their applications, limiting their career opportunities. Across India, nurse practitioners in critical care face a harsh reality. There are no government jobs available for them. This leaves many graduates uncertain about their future and searching for opportunities. In the private sector, jobs for nurse practitioners in critical care do exist, but they are very limited. Even when hired, NPCCs cannot work independently. They must practice under the supervision of a physician or senior doctor. This lack of independent practice is a major barrier. Without the authority to make decisions on their own, NPCCs struggle to fully utilize their advanced training. With no defined career structure and limited job roles, both in public and private sectors, nurse practitioner in critical care graduates face an uncertain professional path. Ambiguity in medico-legal responsibility further complicates the role, leaving both practitioners and institutions at risk. Compared to international standards, the nurse practitioner in critical care degree in India falls short, lacking global recognition and comprehensive training. Acceptance of nurse practitioners in critical care remains low, largely due to gaps in training and education.
Many doctors are reluctant to accept nurse practitioners in critical care, often questioning their qualifications and readiness. Some say, if nurses want to practice medicine, they should go to medical school. This attitude, combined with insufficient specialized training, blocks their effective integration.
As a result, nurse practitioners in critical care face limited job opportunities in government hospitals and are often rejected for positions abroad. Internationally, many receive rejection letters, citing lack of recognized training or credentials. Lack of awareness among the public and healthcare teams further hinders the acceptance of nurse practitioners in critical care. Lack of awareness among the public and healthcare teams further hinders the acceptance of nurse practitioners in critical care. One of the biggest obstacles for nurse practitioners in critical care is the lack of clear regulations and licensing pathways. Without amendments to the Nursing Council Act and related laws, nurse practitioners in critical care cannot gain prescriptive authority or proper licensure, leaving their qualifications unrecognized in India and abroad. The absence of standardized training and alignment with international standards means these degree holders are often ineligible for practice, both within India and globally. The stakes for nurse practitioners in critical care are immense. Across India, many trained nurse practitioners in critical care remain an untapped workforce, unable to fully contribute due to gaps in training and lack of recognition. Education gaps and insufficient training leave these professionals unable to practice at their full potential, both in India and abroad. Without official recognition, the potential of nurse practitioners in critical care to transform ICU delivery remains unrealized. To move forward, these key steps are essential for nurse practitioners in critical care. 1. Update the curriculum to include the latest evidence-based practices and international guidelines. 2. Invest in modern training labs and simulation-based learning for hands-on skill development. 3. Align training and certification with international standards to open real job opportunities abroad. 4. Clearly define legal scope, prescribing rights and licensure for nurse practitioners in critical care. 5. Establish clear career pathways in both public and private sectors for nurse practitioners in critical care. 6. Foster interdisciplinary acceptance through stakeholder engagement and policy advocacy. By taking these steps, nurse practitioners in critical care can reach their full potential and help transform critical care in India. Nurse practitioners in critical care are a vital, yet still under-recognized resource for India's ICUs and beyond. With better training, curriculum reform and strong government support, these professionals can finally gain the recognition they deserve, both in India and internationally. Thank you for watching The Cosmic NP. If you found this helpful, please like, share and subscribe for more insights on advanced nursing and global healthcare collaboration.